everyone, it's Mel Pridemore with 6 Dimensions Wellness Coaching and Personal Training. And this is my wife Jennifer and our 6-month-old Andrew. Today we're going to be talking about post-pregnancy core exercises, which I always thought would be perfect for Andrew to join us. What we're going to do is we're going to talk a little bit about a condition known as diastasis recti, which is really just a medical term for abdominal separation. It's really, really common in pregnancy, but how often you hear about it might depend upon your physician, maybe peers you have to talk about it, or maybe other fitness sites you follow. So what we're going to do today is show you how to assess diastasis, and then we're going to show you 3 different really good post-pregnancy core exercises that are safe if you have diastasis. So what we're going to do first is show you how to assess whether or not you have diastasis after pregnancy. Diastasis really doesn't have much to do with the size of your baby or anything like that. It's really common. It just happens through the expansion of the stomach and the abdominals. They kind of come from here, and they will start to kind of separate out really thin connective tissue. So what you're going to do first is you're going to lay on your back just like Jennifer's showing you here. You're going to have your legs bent with your feet flat on the ground. And the first thing that Jennifer's going to do is she's going to tuck her chin to her chest. Okay? Then she's going to take her hand and place it right kind of at the base of the sternum, or probably where your brow line is. And she's going to start with her fingers vertical. And what she's going to do is she's going to make sure she feels kind of that muscle tone up top just to start. And then you'll see what she's doing is kind of moving her fingers down in a straight line, kind of pushing in. What you're looking for is when you stop feeling that muscle tone, when you maybe feel some softness or you feel like there's a gap, that's diastasis. So for instance, let's say if she starts at the base where we started at the very top. Let's say there's good, she goes down, let's say right here, maybe she feels a little bit of separation. We're going to count fingers, okay? So if she feels separations through all 4 of those fingers, that's how we would begin to assess that. But we also want to go a little bit deeper than that. So you can use 1 hand, you can use 2. So if you have all 4 fingers, you need to bring another couple in. After Jen had Andrew, she had about a probably 6-finger vertical separation, so a fairly big one. So after you assess vertically, what you also want to do is assess horizontally if you have diastasis, like how wide it is. So the way you do that is go kind of the opposite way, so fingers along a vertical, horizontal, and you kind of do the same thing. So she's kind of wiggling her hand back and forth. So after you assess vertically how many fingers of separation you have, you want to do the same thing horizontally. So you might have, say, 2 or 3 finger vertical, and then maybe a couple fingers horizontal as well. And what I would do if I were you, just kind of make note of that at the beginning of your exercise program so you can kind of see how it improves. 1-2 finger separation is not abnormal after pregnancy. When you get up into 3, 4, 5, 6, 7, that's when you really have to watch what kind of exercises you're doing, because you can make that diastasis worse, or it just never improves. That's why you see a lot of women that will say, even after they've lost all their pregnancy weight, they'll say, I saw this pooch, this mommy tummy. A lot of times that's not body fat, that is diastasis, really not holding that on your stomach in. So the 3 exercises, first we're going to show you, Andrew's working out, he's really getting intense over here. So the first one we're going to do is called the hip bridge. And we're going to start with that one because you basically do it out of the same position. It's called the hip bridge because what you're going to do in the exercise that we'll show you is you're going to bring your hips up to form a bridge from your knees to your shoulders, just like that, so kind of a straight line. So she goes back to the start position, and what you want to do, you want to draw your belly button in, almost like you're trying to draw it in towards your spine. And as you bring your hips up, you want to squeeze your butt and draw your belly button in, so kind of from both sides, squeezing at that very top position, then release all the way down. And go ahead and squeeze all the way back up, draw the belly button, squeeze those glutes, and then rest back down. What you can do is I'd say probably start off with about 30 seconds of this exercise. Just set a little timer. That way you can really, really focus on your contraction rather than your reps. So kind of remember, squeeze your belly button in and squeeze your glutes. You really want to keep that whole core area tight. The next one we're going to do, I'm going to kind of slide little man over a little bit. We're going to do the dead bug. Here you go, bud. Okay. So the dead bug is our next core exercise that is safe for post-pregnancy, okay? So what I'm going to have Jennifer do is I'm going to have her bring her hand, we'll start with legs. So you want your legs, you want your shins to be about parallel with the ground. So about a 90-degree angle right here. And you want those to keep tight. And then what she's going to do also is bring her hands up straight in front. The first thing, like with many of these core exercises, is that belly button. It keeps the core tight and activated in the beginning. So right now she's doing this. She should be drawing her belly button in towards the ground, okay? Now you don't want to do this exercise quickly. It should be very slow and controlled. What she's going to do is she's going to start with, let's say, right arm, left leg, so opposites. Going to go back very slowly, and then all the way back to the finish, and then we're going to alternate sides, okay? Here, and then rest at the beginning, and then all the way back out, very slow and controlled, because this is really a core stability exercise. As your arms and your legs get further away from your abdomen, you'll feel your core tighten up, okay? But because you're in a prone position, or you're in the supine position, which is on your back, not in the prone position. In the supine position like this, you can really activate that without making the separation worse, because it's going to draw it in safely. And you go ahead and rest from there. One progression for this after a while is you can add a medicine ball. So I'm going to go ahead and grab one. So if you get to where you're feeling like you're just not feeling the same activation, you can do the same exercise using a medicine ball. Now to keep your range of motion with the medicine ball very limited at first. So you're going to come back and say maybe to about where my hand is. So bring the medicine ball back, one leg out, and then back all the way to the start. And then opposite leg again, so out. And then what you do over time, as you're getting better and stronger, bring that ball back further. And there you're back to the beginning. And really aim to keep your arms extended. That's really going to challenge your core. Okay, and then the last one we're going to show that's safe for postpartum is the side plank. Now with regular planks, that's one you really want to avoid if you have diastasis. When you have diastasis, you do things in the prone position, such as push-ups or planks. You're really putting a lot of force on that separation, and not in a way where it's going to impact it in a way that you want. It can make that diastasis worse, or you're just not going to get anything as much out of it. So you want to keep things either in the supine position on your back, or if you want to do a plank, we're going to show you how to do a side plank. So we're going to start with a modified side plank, which is on your knees and on your elbow. So what Jennifer's going to do, she's going to, again, kind of bridge that, her hips up, and she's going to try to keep straight from her knee up to that other arm. So she's going to keep the hips up. And again, we're squeezing the glutes, we're squeezing that belly button in. So we're trying to get the whole core tight, tight, tight. And then she's going to rest. So I would say when to start off with that, even 10 seconds to start will probably feel challenging. Start with 10 seconds, and then you can switch sides. Build up to a 15-second hold, a 20-second hold. And then after you get really proficient at it, you can go ahead and rest, Jen. You can progress into a full side plank, which is on your feet. Okay, so still on the elbow. So right here, that makes it harder because your base of support is further away. So she's going to be on her feet here, and we're still trying to hold those hips up and squeeze, keep everything active, keep the hips up, and then we're going to rest. So just as a reminder about with the hip bridge, I'd start with about 30 seconds. Same thing with the dead bug, without using any equipment. You don't need a ball or anything to start. The side plank I would start with about 10-second hold on each side, and then progress up to 20, 25, maybe 30 seconds, then go into that full side plank. If you have any questions, feel free to comment. But just most important thing to remember with diastasis is that it's extremely common, and how you exercise postpartum can do a lot to make it better. But you want to avoid things that are going to make it worse at first. Just give yourself time to heal up. And what I would do is be reassessing your diastasis probably about every 4 weeks. Okay? I hope you've enjoyed this video. Feel free to share with other women that might not be aware of what diastasis is or how to assess it. That's Andrew saying goodbye and farewell. Thanks for watching. Feel free to comment with any questions. Thanks.